I want to also promise you that I get it, because women's health and maternity care is one of my top priorities as Health Secretary, because we are more than half the population and our health care matters not just to us as individuals, but to our families and wider society. Now, as Maria rightly said, we have already come a long way and transformed many lives by driving forward the women's health strategy we launched some 18 months ago. But together we can go further still. I want to reform our NHS and care system to make it faster, simpler and fairer for all of us, and that includes women. Because for me, this is personal. The NHS diagnosed me with type 1 diabetes at the age of 3, and so I have seen the very best of the NHS, but I've also seen some of its darker corners. And I'm going to go a little bit off script here, which always makes officials worry when ministers do this. But one of those darker corners was when I was pregnant. As the clinicians in the room will understand, pregnancy with type 1 diabetes can be a very medicalised process. And there came a point in the pregnancy where it became clear that baby was going to have to be delivered early. And so I was rushed into hospital, and the hospital that looked after me amazingly well simply did not at that point have the facilities to look after someone who was both very early in pregnancy but also with complications. And so they put me in a ward with women who had just given birth, literally, rushed from theatre, and who had had very traumatic experiences. And you will understand how deeply worrying, actually, and dare I say it, frightening it was to be lying in that ward with women who had gone through, frankly, a hellish experience, who were in agony, who were needing very, very urgent medical treatment, and for me to be there, ready to to have my baby. And that, looking back, I know that everybody was doing their best, but I desperately want to ensure that women who are expecting and who find themselves needing a bit of extra help, that they're not in that situation and they're not facing the fear that I faced. And so, as I say, I absolutely get it, and it is very much personal for me. But I want to set out some of the policies this year that will help light the way to better health and happiness for women. And I'm going to start, first of all, with a number: 293. From independent research published last week, that is the number of women who died in pregnancy or within 42 days of the end of pregnancy in the 3 years between 2020 and 2022. That number means that 293 families are grieving the profound loss of a mother, who will also be someone's daughter, partner, wife, sister, or friend. And their babies who have lived, well, their loss is indescribable. They will never know the warmth of their mother's cuddle, or the tinkle of her laughter, or indeed the limitless love that we have for our children. Now, not all of these deaths are linked to poor maternity care, but many will be, and this must stop. Important and frankly stark reviews into maternity services have identified how, why and where mistakes happen and harm is done. And in response, NHS England has set out a large programme of work to tackle this through its maternity and neonatal services plan. This includes the establishment of 14 maternal medicine networks across England, which will ensure that women with medical conditions that predate or develop during pregnancy, from cardiac disease to diabetes, all receive the specialist care they need. Fairer access to services must be achieved, and underperforming trusts must shape up. To achieve this, a maternity safety support programme is giving underperforming trusts assistance before serious safety issues arrive. And I will give these and other measures my full backing to support families and end preventable maternal and baby deaths. Because the birth of a child should be amongst the happiest moments of our lives. And for the overwhelming majorities of families, of course, it is. And we want this for every woman and every family. But this commitment also requires